Hi there, I'm a pelvic health physiotherapist working in Paris, and I'm hoping this video will help you to find out how you can restore your pelvic floor to optimum functioning. So first of all, a bit of anatomy. To look at the pelvic floor, we have the view from your spine here, and looking through at the muscles as from a bird's eye point of view. If I turn the pelvis over, you can see that we've got the coccyx down here, the tailbone, and the pelvic floor is a very big, thick muscle over this way, but it also comes this way and it's going around the sides, okay? So the pelvic floor is a group of muscles, it's not just one muscle. But in order for it to be functional, it needs to be able to contract equally all the way from the back towards the front. If it gets stuck towards the back or it gets stuck on either side, then it's not going to get that full pull forward to the front, to the urethra, which is going to stop you leaking, okay? We also know that the pelvic floor is 70% autonomic and 30% active. The autonomic side of things is it's always working. It's connected, similar to the breathing muscles. You're always breathing. The pelvic floor is always working to 70%. And if it didn't, you'd be leaking urine or leaking stools if you didn't constantly think about tightening it. So you can get an extra activity by squeezing, but there is a 70% that should be working all the time. Same with your breathing, it's always working, but you can override it by taking a deeper breath in. But your breathing's not going to stop because you don't think about it. Now, if we get dysfunction to the pelvic floor, then that 70% can be affected, but also that 30% that we squeeze. And just squeezing it alone deals with that 30%, but actually let's look at how do we restore that 70% autonomic side of things. Okay, so to get the pelvic floor working optimally, there's several factors to take into consideration. There is posture, there is core muscles and how they work together. There is our breathing and how our breathing affects the pelvic floor. And there is making sure the pelvic floor is not just strong, but also relaxed and stretched. So first of all, posture. In order for those pelvic floor muscles to work equally, we need to be using our core muscles, that's our abdominal muscles here, and our glute muscles here, and the general pelvic muscles. They all need to be working equally for the pelvic floor to work with them equally. If one gets weak, for example, you have abdominal surgery, cesarean, hysterectomy, you might just have a big baby that overstretches the tummy muscles and those muscles switch off, then the pelvic floor and your back muscles and your glute muscles might do extra work to try and compensate, and that can lead to overly tight muscles. And if we look at the pelvic floor here, look how big those posterior muscles are. So if our anterior muscles stop working so well and our abdominal muscles don't get strong, then we might get an overworking here. And look how close they are to the anus. And you've also got this double layer. You've got quite a thick layer around the anus area. It can lead to constipation, but also if there's not enough support coming to the front because it's so tight at the back, long term that can lead to prolapse and incontinence. So if we get our pelvis in the right posture and the right position, we'll actually find that our core muscles naturally want to switch in a whole lot easier. So just thinking about your pelvis position, and I want a neutral pelvis. So this belt line here needs to be like the rim of a bucket. And I don't want to spill any water out the front of the bucket. I don't want to spill any water out the back of the bucket. So I find that neutral pelvis. And now I find that my glutes are working a little bit, not clenching everything. I'm just in that posture. My glutes are working a little bit. My tummy can function a little bit. And then the pelvic floor can work normally. Okay. You can just feel how the pelvic floor feels in that position by feeling your pelvic floor squeeze in that neutral position, feeling your pelvic floor squeeze your bottom out, feeling your pelvic floor squeezed, slumping. It might be easier to feel it if you're sitting down. So if you just sit down on a chair and slump back in your chair and squeeze your pelvic floor, you'll probably feel it feels more posteriorly because now you're slumping, you're overworking the posterior part. If you lean forward, you're now going to feel it more at the front. So if you sit upright with that neutral pelvis, you should be able to feel an equal contraction of the pelvic floor from back to front. So posture is really important for a normal functioning of your pelvic floor. Your activation of all your muscles equally and restoring your core muscles is really important for the pelvic floor. And then if we look into that 70% automatic side of the pelvic floor and what affects that. So the autonomic nervous system is highly driven by stress and fight or flight. So there's lots of studies where they've had women watching emotive films with electrodes throughout the body on different muscles and various muscles, including the pelvic floor. And the discovery is that the pelvic floor is one of the first muscles to respond to negative emotions and to stress and to fight or flight, which is amazing, really. And actually, if you think about this big muscle, it is supporting everything above, up to the diaphragm level. So it's supporting all of those pelvic organs and your stomach contents. So it has to be a big supported muscle. And if you're going to have to run away from something in a fight or flight mode, that pelvic floor needs to be nice and firm and tight to support your body as you get into your fight or flight. Now, that's not a problem if it's a one-off. But if that fight or flight system gets triggered day in, day out, and maybe multiple times in your day, then that pelvic floor is not just tightening up and letting go, it's tightening up and tightening up and tightening up. And it's going to keep getting tighter and tighter until you potentially have a very overactive pelvic floor. So what puts your fight or flight system on edge? We know that cortisol is a really big steroid hormone that's really part of that fight or flight system. We all need cortisol to move. It's part of, it's needed in exercises. We all produce it, and we'd have problems if we didn't produce it. But it goes up throughout the day and it comes down when we rest. When we sleep, those cortisol levels come back to normal. When we don't sleep properly, or we're releasing extra levels of cortisol because we're going through a stressful situation, it can be a physical trauma, it can be an emotional trauma, it can be an ongoing anxiety that we might be having. That cortisol level gets higher and higher and doesn't get a chance to actually come down and settle. The result of that on your body, you might know that feeling of neck tension, of head tension, you might feel like you're being strangled, tension around your breathing muscles, tension in your pelvic floor. So for some of us, we might recognise that feeling of anxiety, and for other people, we might not have actually grasped that's what that feeling is coming from. And ultimately, the pelvic floor is going to tighten. That might look like bladder urgency for one person. That might look like stress incontinence for another person. It might look like pain in the vagina for another person, pelvic pain, pain on sex. The pelvic floor goes into tension, and it can create these different symptoms. If it goes into tension at the back and it can't pull forward to the urethra, you're going to leak. But for a lot of people, it is bladder urgency and having to run to the toilet lots. And it's because that fight or flight system is creating extra pathways to the bladder, to the pelvic floor in that fight or flight mode, because it's like, get ready, get prepared. So we're looking at the fight or flight system, we've got posture, we've got core muscles, and how do we get that best function out of them, especially if there's that emotional trauma. And I would have a think, if you can, and think about, is there a particular trauma that you can remember that triggered that your started your pelvic floor symptoms? Okay. Think about the postnatal mum who went into pregnancy thinking they're going to have a great labour, and got into labour, and actually the labour was very painful. It lasted a lot longer than they thought. It ended in instrumental delivery. It was an emotional trauma. Then you go home with a baby. You've never had a baby at home before. It changes the dynamic of your relationship. And your baby is screaming maybe, it cries a lot, may have colic, it's not sleeping, so you're not sleeping, so your cortisol levels are getting higher and higher and higher. And then you might think, 3 months on, I'm starting to leak. I've noticed I leak a little bit. And you think, gosh, my pelvic floor must be weak. Well, it might be that it's been damaged and weak, but it also might be that it's in fight or flight mode and it's overactive. Okay. So it's really what we got to do is identify, is that emotional trauma something that is so great that we need to talk to somebody about? Do we need to go and talk to the midwife, to a GP, and get a referral to some psychology counselling and trauma therapy? Or is it something that we can actually manage at home with breathing and relaxation? So I've talked about posture. We can think about our posture. I've talked about doing some Pilates, like core exercises, Pilates to restore the core. Actually, let's talk about the breathing, because it's such an important part of trying to change that fight or flight system. Now, when you breathe twice as long as you breathe out twice as long as you breathe in, do several things. We reduce our sympathetic nervous system, we reduce our heart rate, we reduce our blood pressure. And so in turn, we reduce that fight or flight system. 10 minutes a day of breathing in for 4, out for 8, or in for 3, out for 6 can be really calming on our nervous system. Okay, you may have done hypnobirthing in pregnancy. If you haven't and you're pregnant, I would really recommend looking into it, and I wouldn't just leave it till you're in labour, but if you can do it 10 minutes a day throughout your pregnancy, you've got the best chance of your pelvic floor being in a relaxed position so that it can actually be much easier for that baby to come out. Okay, and if you're postnatal, keep doing your hypnobirth breathing. Don't stop it. It's just crucial to do 10 minutes of breathing throughout your life, because we go from one anxiety to another, and life is full of traumas and emotional traumas. And if we can manage it with doing 10 minutes of breathing a day, that's a really great way of looking after our bodies. Okay, so we've talked about breathing out twice as long as breathing in. You've probably heard about belly breathing or diaphragm breathing, and it can be really relaxing to just imagine that breath going deep into your tummy muscles and then releasing it out again, and that can be really relaxing. I'd also like to talk about breathing into the ribs, because it's so important to get our lungs moving. When we get stressed and anxious, part of the reaction to cortisol production is that our connective tissue, our fascia, gets tight because it's ready for fight or flight. And as that tension gets tighter and tighter, you might have that feeling that you're in like a wetsuit that's too small for you, pulling you forward, pulling your shoulders over. Now that fascia is really thick around your ribs. So if you can breathe it into stretch, then you're going to have a great way of releasing it. So we're going to breathe in through the nose, out through the mouth. Breathing in to those ribs, a long breath, out through the mouth. In through your nose, long breath out through your mouth. Think about also a good posture, so you're finding that neutral pelvis. And what you might notice is as you're doing your long breath out, 8 seconds, is your lower tummy muscles want to start kicking in. Your core actually will start to kick in when you're breathing correctly in a good posture. And also, just think about your pelvic floor. So breathe in, feel it relax. As you breathe out, and it might want to rise up, and let it rise up, and you'll feel that as your posture's in a good position, as you breathe out, the pelvic floor lifts anteriorly at the front. I've got a little Zorb to show you. So as I breathe in, pelvic floor releases. As I breathe out, it gradually tightens. Okay, breathing in, try and feel it fully relaxing, and breathing out, it's rising up. Now what we're getting is, as we're releasing that fascia, we're doing the breathing that kicks into the autonomic nervous system, is that 70% of your pelvic floor is going to kick into action. And when that 70% kicks into action, your fight or flight response, you start getting appropriate fight or flight responses. So if you cough or you sneeze, your pelvic floor does the appropriate fight or flight reaction and contracts at the right time to stop you leaking. So we've got posture, core muscles, breathing, and then I was going to talk about pelvic floor stretching. So if you've been in a poor posture for a while, or if you think your pelvic floor might be overactive, particularly athletes that do a lot of running or a lot of sport in certain postures where the pelvic floor ends up getting very tight posteriorly, then pelvic floor stretches can be a great way of releasing that. That's your yoga type stretches, sitting back on your heels into child's pose or prayer pose. There's lots of videos on YouTube, and there's links on our website to pelvic floor stretches, and you can combine those stretches with the breathing, do the deep breathing within those stretches. But give it a go. Whether you've got a pelvic floor that's too tight or feels weak, have a go at doing the breathing, contracting the pelvic floor on that out breath, feeling it release on the in breath. Think about your posture, have a go at the pelvic floor stretches, and I think you might be surprised at the change in your pelvic floor function. You might even be questioning, well, how do I know if my pelvic floor is weak or overactive? But if you're not sure, if you think about your posture, looking to strengthen your core, think about doing breathing 10 minutes a day, feeling the pelvic floor activate as you breathe out, you will notice a difference, and the pelvic floor will start to function as normally as possible.